Hello and welcome to my channel Empowering Aesthetic Excellence. In today's episode of the Aesthetic Dialogues, our guest today is Dr. Mahua Chatterjee Debnath. She is a consultant aesthetic physician practicing for last 20 years, a postgraduate in non-surgical facial aesthetics from Anglia Ruskin University, UK. She also has completed her postgraduate diploma program in clinical cosmetology from Ilamed, India, and has a wide range of experience in handling various range of cosmetic dermatological procedures. She also has a postgraduate qualification in hospital administration from the National Institute of Health and Family Welfare, New Delhi, India. She has a wide range of administrative experience in the wellness category of the corporate sector. She has completed her graduation from Calcutta National Medical College, Calcutta University, West Bengal, India. Consequently, she developed and equipped herself with the skills that are required in the upcoming trends of aesthetic dermatology across the skin and hair treatments through a combination of technologies and or procedures such as lasers, chemical peels, mesotherapy, PRPs, or facial aesthetics. She is a dynamic and confident senior aesthetic physician with a great interest in non-surgical facial aesthetics. She has adapted herself with the latest and the best global practices that are applied in procedures pertaining to Botox, fillers, and thread lifts. She has performed umpteen number of procedures on Botox, fillers, and thread lifts since the last 16 years of professional service. She is widely respected in the aesthetic business industry. While her views have quite often been published in the print media, she has also quite often been invited by the electronic media and professional associations for panel discussions and for sharing experience and views on aesthetic services and businesses on laser skin and hair treatments in various conferences. So without any further delay, let's welcome Dr. Mahua Chatterjee Debnath. Hi, Dr. Mahua. Welcome to the Aesthetic Dialogues, and I'm so proud to have you here and have a conversation with you.
Thanks, Bhavna. It's been a long association with you, and it's a great pleasure for me also to be on this platform to share some special experiences with you.
Yeah, so it'll be lovely talking to you, I guess, because we've never, talked in this context, We've talked
Yeah.
about treatments, we've talked about problems, but this is going to be different altogether.
Sure.
So, without any delay, I'll start with my questions. So, are you ready?
Yeah.
Yeah.
Yeah, I'm ready.
So, Dr. Mahua, my first question is that we all began in a dark room, clueless, directionless, and we are the generation of aesthetic practitioners who have lived and learned. We didn't have any mentors or things like. And some of us were under the corporate umbrella. Some of us had brand connections. Some of us were so intimidated by the stream that we got ourselves internationally certified and stuff like that. So, how is it that your narrative commenced, and how have you managed to keep your story in a successful and a beautiful way?
Okay, so then I have to take you back 20 years from now when aesthetic medicine was yet a term to be known widely in India. We had started with some basic procedures like maybe chemical peel, some small machine-based, energy-based devices, and laser-based treatments. So this was how it started with. And because people wanted to look good at all times, it gradually gained momentum. And then finally, we saw Botox and fillers, which came later in the next decade. So, if you ask me, it started gradually, and as we progressed along this way, we had different treatments adding up. And that journey was very niche, if you ask me, but we were all very fresh. So we learned along the way. There was no pre-arranged or there was not any particular course or any like a degree or a diploma which could teach you all this, right? So along the path of our experience, we gain knowledge. And like you said, there are international treatments, there were forums, there were these vendors, and as time passed on, we realized that we have a vast majority of treatments, mostly injectables, gradually gained momentum. And I think that's how. But definitely because I was with a corporate chain clinic and we both shared quite a few number of years there. So
Yeah.
our journey was different, and we were the first one, the pioneers to experience these treatments when they were first launched in India. That way, I said that we were lucky in that way
Yeah.
to get an exposure.
Yeah, to get an exposure. But then it has pros and cons, because if you are the first ones to do it, then you have to you take the all the acknowledgements also, but you have to bear the brunt also sometimes.
Yeah, if you ask me that way, initially there were not many takers
Yeah,
for this kind of courses or this kind of profile. We were a few doctors who were either general practitioners, or maybe they were a gynecologist or some other, because in our chain clinics, you remember, we had mostly gynecologists and
yeah,
some medicine people and some MBBS doctors.
right.
So we started with the procedures, and we had training programs from the corporate office, and used to train people, but there was no separation of
There was
profile
nothing
as
structured or
such. There was no
curriculum.
structured,
Yeah.
nothing. Anybody who is interested was most welcome, and we used to train
Okay.
them, and we were on a journey together.
So I guess we
I
are the
think that,
ones who can structure it now.
yeah. I think the more it progressed, and people realized the potential.
Hmm.
And
Right.
if you look to like today, I think Botox and filler-based procedures account for more than one third of
Yeah,
all the aesthetic procedures performed worldwide,
exactly. And it's a
right?
household name
So
now.
yeah. So obviously, so when it has gained so much of momentum, so everybody wants to look good, and obviously they're doctor hunting. So that is when people
Yeah.
realize that we need more and more aesthetic practitioners.
Yes,
Now,
yes.
again, aesthetic practitioner was a term which was not defined, which is still not very
Still
well
not defined.
defined.
Yes.
Right. So aesthetic practitioners grew up. I was one of the aesthetic practitioner. You also joined us as aesthetic practitioner. And in the meantime, we realized that dermatologists, plastic surgeons, everybody was a part of it. So
Yeah.
there was no demarcation at that time.
Right, right. Very true. Great. So now you imagine that you are in a time machine and we are taking you 20 years back.
Yeah.
So how would you do things differently in the professional way?
Yeah.
What is it that you would do differently or you wouldn't do differently?
See, to start with, I'll not say I'll do differently, because being in that corporate structure where we were, that is how we got the exposure. I'll not exaggerate. If I was running my own clinic at that point of time, I would have not had that exposure. So we had that exposure for those treatments, which was very essential. But going forward, I feel that even at that point of time, we should have some organization which should have come forward for a structured
Right. So
training for that, or
yeah,
a course for that matter, a diploma or a degree, whatever. In that case, what would have happened, unlike now where we have everybody and anybody and these beauty parlors and salons,
yeah,
like everybody doing those treatments,
yes,
we would have people who are qualified, who are trained, who have an additional diploma or a degree in this, like we are having like in this international degrees that we are getting. But that,
right.
if in India we could have done it at that point of time, I think it would have been a more organized sector,
Yeah.
and things would have been different.
But nobody thought through it at that point of time.
It's hot to it because, like I said, there were only very few people.
Very few people.
There were
And
very
very
few
few people
people,
realize that
and
this
very
is something
yeah,
important,
and it was initially, if I remember, only Delhi and Bombay.
Yeah, yeah, very true.
Delhi and Bombay to start with, because I remember traveling across India at that point of time, because we didn't have that many doctors across India.
Right.
So we had to travel, and it was Delhi, Bombay mostly which were doing those procedures. Once
Yeah,
injectables came in, Botox, fillers, threads, we
right.
didn't have qualified doctors at a tier 2 city or a tier 3 city to execute those problems.
And if at all you had the client information and the knowledge that people have to accept those treatments was not there, because I was in Jaipur. I attended the 2002 Botox launch in Delhi. And for 7, 8 years, it was a dormant phase for me because nobody was accepting those treatments. So tier two,
Yeah.
both ends, it was deficient thing. Like the practitioner was there, but
Yeah.
they were not open to these treatments.
That's what I'm saying. That's where chain clinic or
Yeah.
these wellness centers or a medispa, that gave a scope,
Scope.
because that is where patients were inquiring. They
Inquiry.
didn't know where to inquire about these treatments. In
Exactly.
hospitals
Exactly.
also, initially it never picked up. It
Still, it's
still
not there.
has not picked up in that.
Never
So
picked up.
people don't want to go to hospitals to get an
Correct.
anti-aging treatment. They were
Right.
looking at a medicine, they were looking at an aesthetic clinic,
Right.
wellness clinic.
Wellness
So I
clinic.
think that is how it grew.
Right. Great. So, on a scale of 0 to 10, how easy or difficult it is to manage an exclusive aesthetic practice as compared to
Mhm.
other clinical fraternities?
See, where a clinical fraternity is concerned, you have a set rule, a set regulation, set people
Right.
doing set things.
Right.
Like I
Right.
said, because aesthetics segment was not structured, there were no
Unorganized.
guidelines,
Yeah.
right? So it was SOPs made by us. We
Right.
made treatment SOPs, we
Right.
made consent forms,
Yeah.
we decided what are the guidelines,
Hmm.
who
Hmm.
is the eligible candidate, who is not, what are the complications, possible complications that can happen. So it was a new thing which we developed.
Right.
So we didn't
Along
have a
the way.
set. No.
Yeah.
As of now, also, if you ask me, give me an ideal aesthetic center where I want to go and I want to learn. And
Yeah.
not only the part where you are hands-on doing the treatment or
Yeah.
practitioners doing the treatment, it is the administration, it is the marketing, it is the strategy,
Right.
everything. You have not been taught.
Exactly.
If you ask me, I have a diploma in hospital administration also. But
Right.
does it teach me how to run an aesthetic clinic? No.
No, it doesn't. It's altogether a
So,
different
like I
domain.
said, so we grew and we are learning.
We're
If you
learning.
ask me, I also set up my aesthetic clinic, but it is a learning process. I
Mhm.
have my own SOPs, I have my own treatments, I have my own product, own marketing, own strategy.
Right.
So
Right.
there was no one to teach me. Like if you ask me, there are 10 hospitals which you can look up to.
Nothing. You
Like
can't
that, if you
look up to
ask me,
anything.
there is no ideal aesthetic clinic where you can look up to and say, okay, this is the
This
clinic.
is where I want to.
It is
Yeah.
as per the doctor's preference,
Yeah.
what he or she would like to do or not like to do. Like
Right.
for me, I am more of an anti-aging person. I may
Right.
not be doing all the pigmentation protocols which are there because I do
Right.
not have that kind of a clientele or I have not ventured into that area, which I'm gradually venturing now.
Same here. Like I'm also a very anti-aging person, medicine person. I'm not a,
Yeah.
pigmentation or, I'm not the first person who, if you're looking for a pigmentation treatment.
Yes, the same here. So, like I said, that it is totally depending upon what is your specialist area you
Right.
like even body treatments, the
Yeah.
ones where
Yeah.
there are contouring. I'm not talking about core weight loss or something, even
Yeah.
contouring, body contouring. We have not ventured. Some people have ventured and they're doing so well,
They're doing well. So
right?
it is their
So
preference.
there is no ideal aesthetic clinic as of now.
Yeah.
As at least I don't have the knowledge. Maybe you can share with me if you can get it so that we can have a look at it and we can
We can
try to
build
follow
one, I
those
guess.
steps. Yeah.
Right. Okay, that's great. According to you, what is the most underrated and one most overrated treatment in aesthetics at in today's time?
Okay. So if you start with underrated, I'll tell you the first treatment we started with. That was a skin resurfacer, as we call it, when in layman's language is known as a chemical peel.
Right.
Earlier, it had a huge appeal to the patients, and patients used to come, मुझे chemical peel कराना है,
Right.
because there was awareness. But now I feel with the gradual introduction of so many services and lasers and all, it has taken a backseat. But believe me, as a anti-aging treatment, as a pigmentation treatment, if you start with a skin resurfacer, now we have so many varieties and so many combinations.
Yeah.
At
Yeah.
an early age,
Right.
it can do miracle. And if you ask me, I have been personally using it on my face for
Mm-hmm.
the last 20 years
Right. Right.
as a prophylactic treatment. So I think that is highly underrated nowadays. And overrated, if you ask me, I'll say face PRP, I feel is overrated.
Okay. Okay.
Because
So
the expectations that are set out of a face PRP,
right.
post infections and the minor bruises and the swelling and whatever, it has a downtime.
It has a
And the
down.
expectations which are set are not realistic. People expect wonders out of a face PRP, which is not always the case. Even if you have attained a result from PRP, it is very, very, very short-lived, a month.
Short-lived. Right.
So I feel face PRP has been glorified. It has its role, but
Yeah.
there are better options with the same
Has
downtime, with the
more of
same
a,
price.
it has role in maintenance. You cannot consider it as a treatment as such. But if you're doing anti-aging treatments, so PRP can be a very good adjuvant or,
Yeah,
secondary
it
thing
has its role. We all
for
agree.
the,
But like I said,
yeah,
people's expectations are huge out
expectations
of
are
PRP.
huge, huge.
So
Right,
I feel it's overrated.
right, great. So now, coming to our brides, So in
Yeah.
earlier days, we had what we call the blushing brides. And
Hmm.
nowadays, what I see is brides in boots. People
Hmm.
are finding their comfort zones and their choices have changed. So, how do you think this mindset transformation is reflective of the beauty choices that the Gen Zs are making?
So if you talk about bride, so I feel that it is the day when the girl wants to look the best, right?
Yeah.
So there is a preparation for that.
Hmm.
Okay, so that preparation has to be good skin.
Right,
Even makeup, your dress, your lighting, your videos, everything can be edited, but a good skin cannot be edited overnight.
right.
So I feel if you are preparing your skin at
Mm-hmm.
least 6 months before your event,
Right.
in case you do not have the issue, just take a normal skincare. If you have a skin problem which needs time and treatment like a scar, it cannot be treated overnight. You need a year at least.
Right.
So I feel that correction of a skin problem has always been there. Be it
Right.
today, be it before. People earlier didn't have the knowledge, they
Mm-hmm.
didn't have the exposure. Nowadays, people have it.
They have
So
knowledge
they want to
exposure
look
and
the
they're
best.
open to it. They are opting for these procedures. Earlier, people
And I'll tell
don't.
you, I have had mothers who have come to me
Mm.
and maybe they have taken boosters at one point of time for brightening and that excessive glow or the excessive radiance that you expect
Yeah.
on your day, on your
Yeah.
special day.
Yeah.
So I have seen mothers coming with their daughters and telling me that we want that for our daughters for their special day.
Yeah.
I'll not say Botox or other anti-aging treatment, but I feel skin boosters have made a
Skin
huge
boosters
role.
and lip fillers,
Yeah,
or
yeah, they
I
have.
guess
Yeah, yeah.
brow
Lip
lifts.
fill is obviously where they want the pout,
Yeah.
but that is where somewhere you're trying to change your look. But without changing your appearance,
Right.
a booster can add. And see,
Yeah.
also the fact you have to consider that nowadays people are marrying late. So
Yeah.
that natural glow that used to be there in your
Then in
early
their
20s
20s
is
and all
not there.
is not there.
People are coming late 20s, early 30s. So
Yeah.
there is skin booster, which people were earlier not so open about getting an injectable treatment done. I feel now they are okay, and even their parents, their
Mm.
family is also okay.
And brides want to feel comfortable on their special day. That is why they're
Yeah.
opting for booths and all. And so if they get skin boosters done, they're very less dependable on the
Yeah.
makeup that they
The
have to
other
carry.
thing, yeah.
Cumbersome
Like I
makeup.
said, see, makeup will always not be there. Like you're getting a bridal makeup
Yeah.
during haldi, you are getting makeup, but sometimes you will be without a makeup. So
Yeah.
you don't want an absolute different look on your face when the
Right.
makeup is removed. I have even seen people, mostly because see, nowadays, earlier we had those covered
Mhm.
blouses or whatever,
Yeah.
covered cholis and all. Nowadays, you have people with merely a string up and a string down. So their back is exposed.
Right.
So these people who had acne scars and all, they come and they give me an ultimatum that, ma'am, this is the day I'm getting
Yeah.
married. I do not want any scars.
Yeah.
That I feel in the last like last 6, 7 years, I'm seeing more of these kind of
Kind of
young girls
demands.
who are
Yeah.
coming. Yeah, yeah. Earlier, it was only a glow I want on my.
Look.
And you'll remember how many lactic peels we used to do in the
I
bridal
know
season.
lactic
You
peels,
remember?
pre-party peels, post-party peels.
In fact, I remember going to the your Jaipur center and launching a lactic peel event
Yeah.
for brides at that
Right.
point of time.
Okay, that's wonderful. Great. So now you have to author a book. Okay, imagine that you have to
Okay.
author a book, and the name of the book is 10 Foolproof Ways to Practice Medical Facial Aesthetics. So, what are the chapters going to be like? So, this is for
Okay.
a
The
beginner
first
aesthetic
and the most
practitioner.
important.
Yeah.
Okay, so the first and most important chapter, see, there can be an ideal book, but as per me, I'll tell you what is important to me in aesthetic practice. First and most important, and last and most important is counseling. If you do not know
Hmm.
how to counsel a patient, I
Hmm.
think aesthetic practice goes for a toss there.
Course, yeah, definitely.
Right. First
I
is
agree with you.
setting the expectations of a client. That is the most important thing. You have to understand what is the client looking at. She is not diseased. She doesn't have a problem. She has just come to you for a better version of herself.
Yeah, right.
Nowadays, you will see most models. If you see 10 models, you will see they look almost similar. They
Very
all have the V shape of the
V
face.
shape,
They
yeah.
all have lips done. They all have eyebrows tattooed. They all have the same hairstyle.
So it's a
So
standard
that is what
protocol for the face,
looking at.
actually.
Yeah. So I feel first you have to understand that what is that what you're looking at?
Okay.
And is it possible? Can we deliver you that? So counseling and counseling and counseling. I feel when a client comes, I keep 1.5 hours for a client, 2 hours.
Very true.
The
That,
time taken to execute the treatment will be 1/4 of that.
yeah, yeah,
3/4 will be counseling and
yeah.
trying
Very,
to understand and setting the expectations. So
yeah.
that will be the
Gaining
first chapter.
insights, gaining maximum insights into their whys, and then setting the expectations, and then moving.
Expectations, then whatever be the treatment. So that is the first chapter I want to go.
Yeah.
Second, obviously, will be because see, we all read anatomy in our first year
Yeah.
and we have forgotten that by now. So I think detailed anatomy of the face, the muscle structure, the vessels, the nerves, the fat pads, and all that has to be there.
Especially the anatomy and etiology of aging, how the anatomy is changing
That
with
should be
age.
the anatomy, the physiology of aging,
Yeah.
and aging at different stages. And see, there can be no end of treatment. So every treatment protocol has to be there, but like I said, with options. Because we don't have an ideal clinic as of now. So you may have two energy-based device, I may have the other two. So options which can be combined, and there is no set treatment for anybody. It has to be a combination which is tailor-made according to the particular client's need. So
Right.
how to do those permutation combinations, that has to be done. And most important, complication management has to be a part of it.
Has to
So
be a
this
part.
will be in brief, like I said, counseling, knowledge of anatomy, knowledge of physiology, your treatment options, how you want to combine them. There has to be a specific non-surgical and a surgical option. So
Yes.
some people are
For
totally
each
against
indication. For every
for each
indication.
indication.
Yeah.
For every indication, there has to be a surgical and a non-surgical approach. And like I said, then you have your complication management, and then how to, then we can come to the MIS. When you're running an aesthetic clinic, what is the MIS? How you want to keep a record of the treatments being done? How about the consent forms? How to follow up with a client? Then those will be more of stuff related to your administrative skills.
Yeah.
That has to be there. A very important part is that administrative skill, because see, when you are working in another clinic, you are only working as a doctor. But when you have your aesthetic clinic, you are working as an administrator as well. And very important is, which I also feel I still need, is some classes or some knowledge on financial management.
Even I need that.
So we all need that. So that is also very crucial, because uh, once we want to invest, we all like to have all the best equipments in our center, but that is not possible. So
That is
which
not.
technology is beneficial for you, how to do that survey, and how to realize, basically, like we used to have this training need analysis. So understanding what is the need of your clinic,
Yes.
understanding that and strategizing that and arranging your finances. So
Right.
that I think is very important, which we all need.
Yeah.
So I think that
Yeah.
summarizes your list.
Okay.
What
So
will be
your
my
your blueprint is ready, I guess. You can start working on it.
I think I'm a better hands-on person than if
Sorry.
I start writing down books.
Yeah. But I agree with you that we all need financial wisdom,
Yeah, that's very important, and
totally
marketing also.
lacking in it.
Yeah.
Okay, so there's a fun question. Like you have to choose, like if given an option, what would you do? So corporate clinic or chain clinic? No, sorry, corporate clinic or as private practice?
I will choose a private practice as of now, but there cannot be an absolute answer to this, Bhavna, because I'll be lying if I say that that experience that I gained from the corporate clinic where I worked for the last 19 years was the base, or was the foundation on which I could make up my clinic.
Right.
So you have to have that experience.
In the
Until
school.
unless there is something like in your family or your parents or somebody
Mhm.
there who has already aesthetic clinic and you go and sit, you have to work somewhere and you have to gain the experience.
Right. Right.
So that experience gaining has to come, but how long can you want to do that, and how fast you want to experiment or opening up your aesthetic clinic? Because see, all aesthetic clinics don't do the same way. Some are doing
Right.
excellently well, some are doing average, some people are frustrated thinking what to do next. So
Right.
you have to realize when you are ready, but that experience has to come when you are working in a corporate culture, because that gives you structure. And like I said, whatever administrative skills I have, that has come from that experience. But
In-
obviously, freedom,
Hmm.
freedom to do what you want, choice of treatments which you want,
So at some
and
point
to
in
do
time, you
it.
feel that you need that
Yeah,
kind of.
you feel that you want to do things which you are comfortable with. You
Hmm.
want to do treatment lines which you feel are the best. You
Hmm.
want to give treatments in the manner not as designed by somebody or as a SOP, it's your own SOP. So
Exactly.
that cannot be done in a structured clinic or in a corporate. That you need your own,
Own space.
as your own
Perfect.
space.
Very well answered. So devices or injectables, which is your, favorite? What is it that you
Again,
enjoy
I
doing?
I enjoy doing injectables because, like I said, I have an anti-aging practice.
Yes.
But you have to understand your clientele will give that answer to you. Not everybody will go for injectable. I love doing injectable, but
Mhm.
I still have most of the devices in the anti-aging category, which I may need for a client who is not ready. So
Right.
personally, I prefer injectable only for the fact that the downtime is less,
Mhm.
early results, and
Right.
client satisfaction is much more.
Much more higher.
Much
Yeah.
more because it's
Fair enough.
instant.
Yeah.
I believe that fillers give instant gratification,
Exactly. True. Very true.
right? Heads and Botox, still you have to wait for some time. The gratification that a filler, a
Filler.
hyaluronic acid filler gives to the client cannot be compared with
And to the
anything.
doctor also now.
Definitely.
If you are an expert.
Yeah, yeah.
Not otherwise.
Both for patients and for yourself
And for yourself. Great.
when you're doing
Wonderful.
it on yourself also.
Yeah. So what do you prefer? Where do you prefer going to? Conferences or trainings?
I believe everything from every conference, from every training, there is a learning. But I personally prefer hands-on training where you are allowed to inject or execute a treatment in front of a specialist so that you know where you are going wrong.
Right.
That is my preference. Because I see a person executing a treatment in a seminar or in a conference.
Mhm.
But when I'm doing it on my own, in my own clinic, there is
Right.
nobody to tell me where I went wrong.
Yeah.
So that is where I feel I need somebody to handhold me. So I always prefer those trainings one and on when I'm injecting or I'm doing a laser or I'm doing a HIFU or whatever treatment it might be. And there is somebody to a specialist in that field to supervise whether I'm doing it right or I'm doing it wrong. That is my choice.
Perfect.
But everything is.
So now, Dr. Mahua, my next question is that if I show you some celebrity faces, or if I tell
Mhm,
you names of the celebrities, what would your
mhm.
expert comments would be on their, aesthetic treatments, right? So are you ready?
Yeah.
Okay. So first one, Shabana Azmi.
See, before I comment on any celebrity or be it your or my face, one thing we have to understand that beauty lies in the eyes of the beholder. So,
True.
what may be aesthetic to you or me may not be aesthetic to somebody else,
True.
and vice versa.
Very true.
So, coming from there, I believe any celebrity or not celebrity, they have the right to do whatever treatments they want to do on on their faces, right?
Absolutely.
But we, as a spectator, I liked this version of yours,
Right. Right. Exactly.
right? So maybe, so I don't like to criticize any version of anybody because, like I said, maybe if she has got it done, maybe she's liking it.
Yeah.
Maybe
Maybe
10
that is
other
your
people
way
are
of
liking
looking
it,
at
but I
herself.
am not liking it.
Yeah. Yeah. Very true.
Yeah. So I feel that there have been references, like you said, Shabana Azmi. She looks great to me, but her eyebrows have been a thing of debate, and
Yeah,
people have come and said, "I do not want to look like that."
like
So
that.
that is where the concern is. Maybe she likes it, maybe you will not like it.
Right.
So I feel we cannot criticize any decision of anybody's, because
Mhm.
I'm getting things done. Tomorrow you may say, Dr. Moha, I'm not liking the way you have got it done, but
Right.
I'm liking it.
I'm like,
Right. So,
exactly.
but obviously they are public figures, so they are bound to more scrutiny. Maybe nobody will ask me that what have you got it done, but maybe
Right.
my clients will once or twice ask me, have you got something done?
Yeah.
And maybe if they're very sophisticated or a little on the clever side, they'll try to find out what I've got it done instead of
Very
criticizing
true.
the effort.
Whatever I suggest, the first question I get is, have you gotten it done?
Yeah. So that way, I feel that this celebrities, like you said, Shabana Azmi, her eyebrows have been a question of debate. But like I said, while you or I may feel that this is not the right way, or we liked her earlier version of hers better, it is
Yes.
her choice.
It absolutely is her choice, but then they're setting examples, and I
Yeah.
brought up this name because uh most of the times many individuals tell me we don't want to look like that because that creates an
Because, like I
apprehension.
said, they have been used to seeing her in a certain way and have
Right.
appreciated her look. And because she is such a celebrity, people do not accept when they make those changes. They feel that you have to do something which is like which most people like, but that cannot be the case in
And
today's world.
because,
It cannot.
and this is also another thing that they're keeping it that way means that they're liking it. Otherwise,
Yeah,
these
this is
changes are
saying.
easily undoable, you know. It is not
See,
something
the
permanent you're
aesthetic
living with.
definition. Yeah. Aesthetic definition is very, very, very clear. It
Hmm.
cannot be the same. See, if you
Yeah.
remember, we had one training session where we were asked, we were a group of good 30 aesthetic doctors who have been practicing for more than 15 years.
Mm-hmm.
And we had doctors from like 5 different countries in a training session. And we were given faces, and all of us were told to give us our treatment plan.
Right.
And to your surprise, Dr. Bhavna, none of the plans
But same.
were the same.
Right.
15 doctors had 15 plans. So that is a proof itself
Right.
that we don't like to create the same
Same.
look for ourselves.
Mm-hmm.
What I might find beautiful in your face,
Right.
somebody may feel something else is beautiful.
Right. That is the artistic
So,
component over here, you know.
yeah. So imagine 15 doctors treating a same face.
In case with
The
15 different
modalities like
approaches,
Botox fillers were the only options given, and
options,
they all had some different
different
plan for
plans.
all those.
Amazing. That is the beauty of aesthetics, you know.
That day I realized that trainings are good, hands-on trainings are better, but it is your perception, your understanding of the client's expectations, and again I'll reiterate on the fact setting realistic
Yes.
expectations.
Yeah.
Most
And
important.
in aesthetics, I think otherwise also in life also, there you cannot define natural and normal.
What is natural for you may not be natural for me.
Yeah, and what is normal for me may not be normal for you. So it's like wide
Yeah.
variance with it. So now we all have, there was a point in my career where I had an injector's block, you know. I had some problem with a client, and you know, we all have injectors anxiety at some point in time. That the day we have injected, you know, we don't want to take any calls from that person. You know, the moment the phone
Mhm.
rings, we are like apprehensive, like, oh my God, what has gone
Yeah,
wrong?
yeah,
Something.
like,
There could be other
yeah.
things also, but that is what we think. Now, has
Mhm.
there ever been an incident in your career where you've
Mhm.
suffered an injector's anxiety or injector's block? And how have you managed to, you know, get out of it, if at all it was there?
See, as such, I'll not say a block has ever been there. But yeah, I had suffered anxiety because in my career, there was a time where I was traveling across cities
Right.
and injecting patients, right?
Yeah.
So, first of all, I don't know the patient. The first time I'm meeting her, she's being counseled and I'm injecting her. And
Right.
I'm not meeting her thereafter also.
Exactly.
Okay, so I am visiting a city
Mm.
and I am injecting a person
Mm.
I've never met before, and I'm not meeting her after that also.
Right.
unless there is something wrong.
Right.
So that used to give me anxiety, because either you undertreat
Yeah.
so that nothing happens,
Nothing happens.
right?
And
That
if
is not an
nothing happens,
option.
then
You
nothing
want.
happens.
So my point was, should I undertreat the patient? Because if I am treating optimally, there can be side effects, there can be complications. I'm
Right.
talking about known complications.
Exactly.
Unknown to hey,
Unknown
known
to hey.
complications can happen. Yeah.
Exactly.
So my question was, should I undertreat or should I be very safe? Or
Yeah.
should I do my job to the best I is the best option possible?
Exactly. Exactly.
So that was, and at one point of time, I remember, especially when I used to tear trough, I used to be very anxious when traveling,
Mm-hmm.
because I didn't know, will there be a tingle? Will there be too much of bruising? And see, bruising, when you are counseling the patient first time, it is a different scenario. But I used to meet patients who have already been counseled on a very, very, very rosy picture,
Rosy picture. Exactly.
far away from reality.
Yeah.
So if you ask me, I never had problems injecting people I know or whom I'm meeting or whom I can review.
Yeah.
But because of my profile, I had to inject people which I knew I'll never meet again, until unless I go to the same city and she manages to come at the same time, which
Time.
was a very big question mark.
Yeah.
So
Yeah.
that's it. But yeah, the other point I'll tell you definitely was, when we started injecting deeper fillers, like the deeper tissues, and we are told that we have to retract and see whether
Yeah.
there is blood or
Aspiration.
not.
Yeah. Yeah. Aspirate.
So, I was didn't use the word so that layman understand. So, negative aspiration should be there. If there
Should
is
be
a positive aspiration, you know you are in trouble.
trouble.
So we all feel that definitely I'm not in a vessel always. But the times where there have been positive aspiration, I think twice.
Yeah.
Now, should I continue injecting
Or
or
should
should
you
I?
not?
So, positive aspiration has been, but then I discussed it with a colleague of mine, and she said that you should be thankful to God that you got a positive aspiration.
Right. True.
Otherwise, you would have injected
Injected.
and would have landed in trouble. So, that is, I feel, where you need to be careful.
Right. So it was basically injector's dilemma for you. Not
Yeah.
anxiety, not block. It was a dilemma.
Yeah, it was more of a dilemma. And
Dilemma.
like I said, I usually try to be very, very, very safe. I am not one of those over enthusiastic. You have
Right.
seen me, you have known me.
Yeah.
I've always been very conservative injector, but still, these were the areas where I feel care
True.
should be taken.
True.
Especially you're traveling, you have to be very, very, very careful.
I'll tell you something. Whenever I have to travel, I have to go for a holiday. 5 to 7 days before I stop injecting anybody for a filler because I want to enjoy my
That's
holiday.
great.
I
That's
don't want
great.
any, phone calls over there. So I tell them, I'll come back and then we'll do this procedure. Anyway, we all develop our own ways and strategies to.
Yeah, everywhere. Yeah, you have your own way. And the same, I think you should tell your patients also that if you are traveling, don't come before that.
Yeah,
Once you're in town, you should get it. Not only
exactly.
you
At
traveling,
least
but
get
the
it done a
patient
month
traveling also
before.
should get it injected. Yeah.
Yeah. Okay, so one last question. What is it
Yeah.
that you do for your beautiful glowing skin and face? What are your favorite treatments that you do on yourself?
See, like I said, the most underrated treatment, chemical peels, I've been doing it for the last 18, 19 years. I
Okay.
do a glycolic peel on myself once in a month.
Okay.
And I feel that has worked wonders. And with number of hormonal problems that I had in my entire life,
Mm-hmm.
I didn't develop hyperpigmentation at any point of time. And I think one of the reasons is that.
Okay.
Secondly, I feel fine lines, wrinkles on your skin compared to my friends or my age group
Mm-hmm.
doctors I have seen, I have developed much, much, much later. So
Exactly.
that is one thing which I do as a regular. And obviously, as I aged, I started with Botox, and Botox just what Botox does to your face, nothing can do.
Nothing can do. That's
It
true.
just
Very true.
creates a radiance in your face. It just
Yeah.
lifts it up.
Mhm. Right.
And fillers, obviously, I always had a lot of fat on my face, so that way I started fillers quite late.
Okay.
But threads are also my favorite. So I have done. So basically, I have done everything on myself.
Yeah.
The only thing I did later on a patient was filler.
Mm.
Before that, everything I did on myself, and then I did on my patients.
Yeah. Mostly, we practice on ourselves or
Yeah, we
our
practice. Yeah.
spouses.
So all the injectables I've got done on myself. I have done fillers also. I think the only thing I've not tried on myself are boosters.
Boosters. Okay, great. You
That
don't
is
need
one thing I'd
booster.
like to
It
try.
doesn't look like as if you
I've not required boosters as of now. And if you ask me what I started with the hair reduction laser for
Oh,
myself.
okay, great,
Diabetes.
great. So I started with Botox. When was it then when you first got your Botox done? Or first injectable? What was, if you want to answer, it is like
My first injectable. No. I can answer. My first injectable was threads. Because see, you've seen me, I still
yeah,
have a
yeah,
quite broad face.
right.
So my only idea was to how to get a slimmer face. So I
Exactly.
started with threads.
Yeah.
First injectable was threads for me. And if you remember, there was this one treatment which we used to do very often. Nowadays, the treatment modality has this mesolipo thing.
Yeah, mesolipo.
That mesolipo, I remember on all trainings, I used to be the model. Everybody used to inject me. So
Right.
mesolipo and threads were my first treatment to start with. Then
Okay.
Botox and fillers. I'd started only maybe 1 or 2 years or 3 years back.
Okay, that's wonderful. Great, great.
Yeah, there's nothing hiding it. You all are doing it, and I feel you should do it. So why
You
hide
should
it?
do,
If
right?
with doing a treatment, I can look good, I can feel confident, I should get it done.
Even I have,
That is how
lower,
you feel.
broad lower face, but my first treatment was masita for, slimming down the face. And
I
I
got it done later.
right. So thank you, Dr. Mahua, for your time. This brings us to the end of this conversation, and it was lovely and
Is it
wonderful
nice?
talking to you.
Same here. It was a long association with you, but we have never been on a platform like this and sharing our experiences and how we started it all.
Yeah.
It's great remembering all those. The
Yeah.
very best to you also. Hope we meet soon.
Yeah, definitely. All the
Have a
very
great day.
best. Have a great day. Thank you so
Thank you.
much.
Thank you.
Thanks a lot.
Okay. Bye.